So I think आप लोगों का interest आ गया. I am seeing that lot of people are ready to join even 10 minutes before the start of the meeting. That is a good sign. So I think जिन्होंने अपना पूरा मॉड्यूल किया है, I should take their names. Mridula Kachi has sent 3 recipes, one smoothie, one soya khichdi, one vegetable paneer sandwich. Daksha has sent one recipe of smoothie and a blog. Bhumika Nagpal has sent all the recipes of all the faces: Sattu water, Sattu milk, egg wrap. Yusra Nasser has given a blog on Allurion balloon. Shahista has also given a good blog. And Aparna, who joined last time, has also given all the recipes about chicken soup, masoor dal, khichdi, paneer bhuji. I think it's a very good thing. You should all clap for yourself and for your friends. So I think we should all appreciate each other's achievements. Okay, so I think we should start now. So this today is the topic which will make you understand that how bariatric surgery diet is different from Allurion balloon diet, which is very important. So I think we all know about this. So this is our module 4, diet after Allurion balloon. So before I start this procedure, I need to this module I need to tell you that there are some preconditions which have to be fulfilled before we start Allurion balloon procedure. If somebody comes to you and asks about Allurion balloon and seriously interested in Allurion balloon, ask them to start this Pentop 40 milligram on that day itself, because it has to be given 7 days prior to procedure. They have to stop outside or unhealthy food for 3 days, very important, and no alcohol and smoking for 7 days, because if they don't do that, they will have severe colic after the balloon. And just yesterday we have removed our first balloon 48 hours after insertion, because the person took alcohol a day before the procedure. And they have to start hydration 3 liters or 8 cups of fluid per day 3 days before the procedure. If they don't do that, they will have headache after the procedure. So these are all very important. If they don't stop unhealthy food, like there are people who before a day of bariatric surgery or before the balloon, they do a party. I have faced many times that people go, they eat chole bhature, they eat all the ice creams, because they think that they will not be able to eat that food again. That is wrong. So the first counseling you have to tell them, sir, be very serious. You can eat everything after 3 to 6 months in small quantity, but don't eat any unhealthy food or outside food for 3 days before this procedure. So I have made a video explaining everything about this.
अपना मन बना लिया है, अब मैं अपने आप को कैसे प्रिपेयर करूँ। देखिए, जब भी आप मन बना लेते हैं, पहले आप पेंटोसिड या ऑक्सीड की गोली खाना शुरू कर दें ऑन डेली बेसिस ब्रेकफास्ट से पहले। सेकेंडली, बाहर का खाना, अल्कोहल और स्मोकिंग बिल्कुल बंद कर दें, क्योंकि इनसे एसिडिटी बनती है और बैलून डालने के बाद थोड़ा सा कोलिक्स आपको हो सकते हैं, तो वो अवॉइड करें। 2 से 3 दिन पहले अपने आप को अच्छी तरह से हाइड्रेट करें, 2.5 से 3 लीटर पानी पिएं। प्रोसीजर से 1 दिन पहले आप रात को 12 बजे के बाद कुछ ना खाएं, खाली पेट आपने प्रोसीजर कराना है। प्रोसीजर से 1 घंटा पहले 3 टैबलेट्स होती हैं जो आपने लेनी है, पेंटॉप 40 mg, एमसेट 8 mg और एप्रीपिटेंट 125 मिलीग्राम। आप हमारे कोऑर्डिनेटर नूर से बात करके मेडिसिन के बारे में डिस्कस कर सकते हैं। अगर आप कोई पहले मेडिसिन लेते थे शुगर की, बीबी की या थायराइड की, तो केस टू केस बेसिस पे हमसे पूछ लें कि कौन सी मेडिसिन लेनी है। थायराइड की मेडिसिन तो लेनी होगी, शुगर और बीपी की शायद मेडिसिन आपको मना करेंगे लेने से पहले। ये प्रिपरेशन है, सबसे इंपॉर्टेंट है कि मेंटली प्रिपेयर करें कि मुझे हेल्दी होना है, मेरा टारगेट ये है और मुझे इसको अचीव करना है, तो आपका रिजल्ट बहुत अच्छे आएंगे। थैंक यू।
So Amir will share this video with all of you, so you can see it multiple times and understand what exactly we want to tell you. So these tablets have to be taken on the day of procedure. A day before the procedure, after 12 midnight, no water, nothing. This is a tablet to prevent vomiting. This aprepitant tablet has to be taken 1 hour prior to procedure with sip of water. After 5 minutes, they have to take an MSET tablet again. It's with sip of water. It is to prevent vomiting, and this Pantop they are already taking. So these 3 tablets have to be taken on the day of procedure. So those people who have joined recently, I think we should revise the procedure again. The first step is the drinking of the water to swallow the capsule. It takes 5 to 10 seconds. In last week itself, we have done 5 Allurion balloon procedures. And second step is to do an X-ray to check the position of this thread, like this thread is coming here, that it is inside the stomach. This is the step 2. Step 3 is filling the capsule to make it a balloon with the filler liquid which comes with the pack. It takes 4 to 5 minutes. This is step 3. Step 4 is a X-ray again to check the position of the balloon, and step 5 is removal of the thread. So the whole procedure is completed in 10 minutes. So it's a very simple procedure. Okay, so this is for revision. This is the position of the thread and this is the position of the balloon. Okay, you can see the balloon in the below X-ray, how beautifully this balloon is there. These are some healthy patients, and just this patient we did 3 weeks ago, he came from Kashmir and he sent his picture today. In 3 weeks he has lost 14 kgs and he is very happy because he is doing all the things correctly. So now we come to the right thing, the dietary phases. See, in bariatric diet there are 4 phases. In Allurion balloon there are 3 phases, and all the phases are not fixed. Like somebody wants to start soft diet after 7 days, they can start soft diet if their activity has increased. Somebody wants to continue for clear liquid diet for 14 days. If they are taking good protein, then they can continue till 14 days. After that, they can start the soft diet, which is the phase 3 diet of bariatric surgery. And after 1 month, they can start the normal diet, which is the phase 4 of bariatric surgery, which is started at 2 months or 3 months. And this diet will continue till the balloon. Balloon will last till 4 to 6 months after insertion, where the balloon will open up and pass through the motions automatically. Okay. So remember, the balloon size is 550 ml and it occupies half or 1/3 of the stomach when stretched. How does Allurion balloon helps? It gives the feeling of fullness. This message goes to the brain that the stomach is full. So initially the patient doesn't want to drink even water for first 2 days. After that, they eat 1/3 of their original diet. So first 48 hours are the most important because nausea or cramps are common for 1 2 days, but they disappear if the patient has done very good pre-operative preparation. If somebody has taken outside food a day before, or somebody has smoked or has taken alcohol, they may have this nausea and cramps for 3 to 5 days. Initially, first one, say on the day of procedure, they may not drink even water. So don't need to worry if they have hydrated themselves before. And counseling is important, that this nausea and cramps is temporary and it will go away, and after some time you will not feel anything. These are the things you have to tell them, that patient has to lie on the left side, they have to lie with head up, they don't have to lie prone, they have to massage from the left lower abdomen, left lower chest to the umbilicus so that balloon adjusts in the body. In rare cases, if the patient is not hydrated before the procedure and they feel dehydrated, we may call them to the hospital for hydration, and they have to take all the medicines we prescribe them at the time of the procedure, like MSET, Pantop, and a spasmodic medication which is Drotin. And if they are using a BiPAP machine before the procedure for sleep apnea, like this machine, they can use it after the procedure as well. They have to monitor their blood pressure and sugar and SpO2. If their sugar is less than 150, they should not take any medicine or they will develop hypoglycemia. If their BP is less than 140/90, they should not take any BP medicine or they will have low blood pressure. If they are feeling tired, you can, in place of water, you can ask them to take ORS in 1 liter of water to sip over the whole day slowly. I think ORS and coconut water are the important things patient tolerate in the first 48 hours, and that is the time patient may tell you many times, I want to take out the balloon. So if you counsel them well, if they are prepared pre-operatively well, after 48 hours, in next 2 or 3 days they will feel absolutely normal. So that time counseling is very important. So we have to be patient, counsel them. Here the role of dietitian comes. Like in weight loss diets, I have seen you have habits of giving weekly diets. This will not work after bariatric surgery or Allurion balloon. You have to talk to them in first 48 hours, maybe 4 to 5 times in a day. And after 1 week, yes, definitely when they are comfortable, then you can talk to them, message them daily, and after 1 month, weekly diets can be given. But initially, if you give them weekly diet, that will not solve the purpose, because at that time they need support. So that is how this bariatric surgery and Allurion balloon diets are different from normal weight loss diets. If the patient is having some discomfort, you can ask them to call us directly. Important thing to remember, the difference between bariatric surgery and Allurion balloon is there is no hormonal change after Allurion balloon, but there are hormone changes after bariatric surgery. That is why the decrease in hunger is more in bariatric surgery as compared to Allurion balloon. For phase 1, where there is clear liquid diet, there are this 35 options patient can take, like black coffee, black tea, green coffee, ginger tea, mint tea, tulsi tea, lemongrass tea, peppermint tea, buttermilk, and this juices like vegetable juices, carrot juice, beetroot juice, cucumber juice, bottle gourd juice, dal water, rice water, lemon water, coconut water, jaljeera water, soups, clear soup, spinach soup, tomato soup, all these are clear. And everybody may not take everything, so you have to talk to them what are their preferences on the day of the procedure or before the procedure, so you can make a diet chart accordingly and give them what they have to take exactly. Okay, so this you can give them this kind of diet chart daily, like tender coconut water 7 a.m., 9 a.m. If after 48 to 72 hours there are no cramps, then you can start this protein. And in place of homemade protein, initially for first phase 1, give them only whey protein, and if they cannot tolerate that, give them high protein dal water or sattu water, that is also high in protein. So you can start with all these on the third day or fourth day of the procedure when there are no cramps. If there are cramps or nausea, wait. Give them only clear fluids, coconut water, clear juices, and soups. So once they are having no cramps and they have started activity or they are started feeling little bit hungry, at that time you can start the protein. And what are the do's? You have to motivate them that walking is very important. I tell them every time that walking has to be started once you are comfortable on the third or fourth day, and the all the liquids have to be strained in the first phase 1 as you have done in bariatric surgery phase 2. Liquid intake ideally should be 1.5 to 2 liters at least. And protein, you can take whey protein, and if they are comfortable they can take homemade protein after 1 week. And brisk walk is very important. Again, no straw should be used because air can go inside. And if you are feeling nausea or pain, then that means you are drinking very fast. Drink slowly. You have to start 50 to 80 ml per hour and slowly increase to 100 ml per hour. Don't consume any oil, ghee or butter for initial phase 1 and phase 2. And avoid this packaged fruit juices, soups or milk. Ideally make homemade fruit juices or homemade soups. No sugar in diet and no carbonated drinks. Like in clear liquid diet, they may take diet, they will ask you diet cokes and all those low calorie, high energy drinks, low calorie drinks, but they should not be taken, otherwise they will feel uncomfortable. Then after phase 1, this is phase 2, which is again for 15 days. Here some smoothies can be added, like you all have made smoothies and sent to me for bariatric surgery, which is phase 3. Here this is phase 2. So then you can add those smoothies. The soups can become little bit thicker, and these are the things you can add in phase 2. At that time some people may want to eat something. You can ask them one meal, yes you can take that. And that time homemade protein shake is the best in phase 2. If the patient has not tolerated homemade protein shake, after 1 week you are putting them on oral proteins like whey protein or dal waters and sattu water. Now you can convert them to homemade protein shakes in phase 2. You can give them some khichdi, buttermilks, and all those things you are given phase 3 in bariatric surgery. So the Allurion balloon is one phase fast. Again, every don't use oil, ghee, butter and sugar. Liquid should be smooth. Don't use extra salt. Again, water intake is very important, 2 to 2.5 liters. And now you can start homemade proteins in phase 2 easily. And exercise should be at least 40 minutes now daily to maintain weight loss. And phase 3 is normal diet, which is phase 4 of bariatric surgery. This is phase 3 here. And ideally the best diet is negative energy balanced diet. And snacks are very important, and right drinks, like they should not again go back to alcohol or this high energy drinks or carbonated drinks like diet coke. So I'll just give you small example of these snacks. I think this video also you have homemade protein recipes. Amir will share with you. You can share with the patient. It's very easy. This is how I drink every day, this protein shake, and I enjoy it very well. Initially you can make it half of it. Avoid banana if the patient is not comfortable, and milk can be 125 ml. And after patient is comfortable, you can slowly increase to the full blown protein shake at the end of 1 month. Okay, so just understand the calories, the counts. See, when we go to a McDonald's, they give us a burger meal. So one burger is 615 calories. They give French fries which are free, 505 calories, and a coffee or a Pepsi which is 200 calories. So you are taking 1300 calories for a burger meal, which is equivalent to around 20 rotis, because one roti is 70 calories, and you will not be full. After coming back home again you will eat something. So this is how you can explain your patients about avoiding fast foods. Like pizzas, they all have around 300 calories, and tawa roti without butter is 70 calories. Same thing, naan with butter is 317 calories, which is approximately four and a half rotis. So a person going for a party saying I have only eaten one naan, they say how my weight has increased next day half a kilo or 1 kilo. Again, they will not eat this yellow dal which is only 150 calories. Suppose they take yellow dal and two rotis, it will be only 290 calories. But if they take this dal makhani which has butter on, extra butter on it, and this naan, it is approximate, and they take at least two naans. See how much calories there, 1000 calories, which is three and a half times the normal, this two rotis and dal. So 1000 calories is around 15 rotis, just two naans and one dal makhni. If you take dhokla, I think one plate is 136 calories. And see this gulab jamun, only two gulab jamuns is 390 calories, which is approximately five and a half rotis. So if they take two butter naan, one dal makhani, and two gulab jamun at a party, this is approximately 1400 calories, which is again equivalent to 20 rotis. And next day 1 kg weight will increase, and then they will blame you कि we have not eaten anything but our weight has increased. See, very important, we have to teach them how to eat snacks. They can taste just little bit of gulab jamun, no need to take all the two gulab jamuns because they are free. So before that food they will take snacks, and they will be, everybody will be rushing on pav bhaji with extra butter. So one pav bhaji with extra butter is 600 calories, and this besan chila is 143 calories with 8 to 9 grams of protein. So imagine if they have eaten pav bhaji in snacks, then taken two naans and one dal makhani, and then eaten two gulab jamuns as snacks, which they don't think is much. The total calories is 2000, which is more than full day's requirement of 1500 calories. 2000 calories, which is equivalent to 30 rotis, just imagine. And if they take this besan chila, dal, yellow dal and two rotis, it will come out to be 500 calories, which is an ideal diet for a person at one meal. Again, this bhujiyas and snacks are very dangerous. All the snacks 100 grams, they you see on the pack is 550 calories. One small packet is also 30 grams, which is equivalent to 160 calories, 170 calories, equivalent to two and a half rotis. Recently, one of our patients was not reducing weight. When I spoke to him, he was taking 2 to 3 times tea and two to three bhujiyas in a day. So he was taking around 9 rotis already. So how will his weight will decrease? I removed this bhujia and he started losing weight 1 or 2 kgs a day. Very important thing, why we ask you to walk. See, when you walk, this is what happens. See, brisk walking is very different, normal walking is very different. If you brisk walk, it gives you, releases happy hormones in the brain, which is endorphins. Also, there are other important things like your mental concentration is better. And why we say walking 40 minutes is necessary, because for the first 15 minutes only sugar and carbohydrates are burned. After 30 minutes or 20 minutes of walking, we get into the fat burning zone. That is why we say 40 minutes brisk walk will help you burn sugar as well as fats. So this is the very important message you have to give to your patients. Then a take home message, like I give every time. See, when you ask somebody to lose weight, they will say ki sir, we want to go to gym and we will do gym for 1.5 hours today. Then for 1 week they will not do anything. Then again they will go and walk for 5 kilometers in a day. Then for next 6 days they will not do anything. So they want to be perfect, but I want this repetition. Even if they do 10 minutes gym in a day, but they do it 7 days regularly, that is more effective than doing 1.5 hour of gym in a one day and not doing anything for next 6 days. Same is for walking. If they walk for 1 hour in a day and they don't walk for 6 days, is not good. If they walk 10 minutes in a day for 7 days, it's better, because once there is repetition, our brain starts working automatically. The neurons, they start working automatically, and then walking will become an habit for him, and slowly he can increase the time. So you don't force patient to start walking from day one as 40 minutes a day. Ask them to walk 5 to 10 minutes a day daily, but it has to be daily. Then increase the time, 15 minutes, 20 minutes, or increase the gaps like 10 minutes morning, 10 minutes afternoon, 10 minutes evening. Then one time will come when at one go they can walk 40 minutes. So focus on repetition rather than perfection. This is my take home message for your weight loss patients. So this is where we end, and we are ready for the questions. Then we will make some announcements. Yes, anybody wants to ask anything? I hope this was a good lecture for all of you.
Yes.
Yes. Any questions now? Everybody has understood everything this time? I don't think so.
Sir,
Yes, yes. Please introduce before you ask the
sir,
question. So,
sir, this is dietitian Yusra this side.
okay, Yusra, yes.
यस सर सर मैंने आपको जैसे आज सुबह ही डिस्कस किया था कि जैसे पेशेंट्स कंप्लेन करते हैं कि बायोडेट्रिक सर्जरी के बाद जैसे बैक में पेन होता है तो
Okay.
आई डोंट थिंक सो कि वो बायोडेट्रिक सर्जरी का ही है या फिर एलोरियन बैलून में भी ऐसा हो सकता है कि
Okay.
अगर हमें
Now,
कोई केस मिला और बोलते हैं कि
very
हमें पेन हो
important.
रहा है
See,
तो
what will happen is before the surgery, if the patient has obesity and he has diabetes, hypertension, all problems like sleep apnea, he will say it is not because of obesity. And after bariatric surgery, even if he has any small pain anywhere, he will say it is because of bariatric surgery. That is common. Okay. So first thing we have to understand that is the patient psychology. कि अब मेरी सर्जरी हो गई, अब मैं बिल्कुल I should be absolutely normal. Like before surgery, his whole body must be paining, but he will not feel anything. But after the surgery, even if he will have small pain in the lower limb anywhere, he will say कि sir surgery के बाद हुआ है, may be related to surgery. So it is not related to surgery, number one. Number two, when you talk to them, like the same patient, he called me in the evening. What I found is that the body is asking him for healthy lifestyle, which is he doesn't have to sit for 1 hour at one go. After 10 minutes, he had to step up, move around, then he can sit. And he himself told me that if I stand up after 20 minutes, I'm absolutely normal. So that is where counseling is important. Sometimes patient will blame surgery for everything, but surgery has nothing to do with back pain. It improves back pain because the fat is decreased. And if the vitamin D is less before the surgery, if they are taking vitamin D, slowly that body pain will go. Because once they start walking after surgery, they will have pain because they were not having those pains before because they were not walking. So when you start some activity, you will have pain. So you will have pain that will go away once you have an habit and once you complete your vitamin D deficiency. That will go away. Okay. Understood? Anything else?
Hello, sir. This is Shaita here.
Yes, yes, yes.
So, what do we do like when patients feel they're not feeling good because they're not having soft diet or hard diet, like they're not having proper food, they're only on liquids. They say they're feeling
They are feeling
weak,
weak.
like proper.
Okay. So what I told you, if somebody says they are feeling weak, add ORS in 1 liter of water.
In
Okay.
spite of that,
And then if they are still feeling weak, then add protein. See, the habits have to change. They have not eaten for 48 hours. They will feel I have to eat something, but they are not feeling hungry. So
it's the
what you have to do is add ORS and add protein in liquid form, like dal water or whey protein. Start that, which will give them energy. We will give them satiety as well. Both the things will happen.
the thing is, it's their mindset. We get energy only from like food, not from liquids.
You
उनका
tell them
दिमाग
that is where the your role comes and a counseling comes. An excellent dietitian like you all, and a difference between a good dietitian and an excellent dietitian like you all is like you have to understand the patient as a whole, not only the diet. Okay, just it is not the point give the diet and it is finished. No, everybody is different. You talk to them, understand their eating habits, then those eating habits you change slowly, don't change radically. See, once the balloon is there or a surgery is done, radical changes happen. Then patients, their mental What is it saying? The brain. You eat something. You are not eating something. For surgery, there is a hormone change, so you don't feel hungry. But for balloon, there is no hormone change. At that time, you have to reassure them, sir, everything you can eat after some time. Ask them to check their weight daily. See, if they see their scale moving 4 to 5 kgs down, then which will give them the motivation to continue this diet. So very important is to ask them to check their weight daily in first week, because the weight goes very fast. Like our one patient has lost 14 kgs in 3 weeks. He is very happy. He has not started soft diet till now. So what is the motivation? Weight loss. Asked him to check, first thing is weight in the morning. He is 155 kg. Morning he is 151. He is happy, I have lost 4 kgs. Which will be the motivation for him for the whole day to eat the healthy diet. Understood my point?
Sir.
ORS and protein. And
Okay.
slowly we can start the soft diet after 1 week. Give them day by day. So every day you have to talk to them. Then only you can gain their confidence.
Okay.
Yes, any other question?
So Fatima here.
Yes.
What is the reason of giving pantoprazole before the this Allurion balloon?
Okay. What happens is people who are uh, planning for procedure, they are eating a lot of unhealthy food already. So they have some ulcers in the stomach which is not diagnosed. So if you give them pantoprazole, it gives time for healing of that ulcers, which we don't know. Also, if they are taking alcohol and smoking, again chances are there they will have some ulcers. That is why Pantop is started 7 days prior to procedure.
Okay.
And the Pantop tablet continues throughout the balloon for 4 months. Very important to continue Pantop for 4 months after the procedure.
Okay.
Anything
And sir,
else?
regarding
Yes. Who is there?
regarding the balloon, this Fatima,
Yes, yes.
regarding the balloon material, have you come across any time regarding the allergic reaction because of
Okay,
the
that
material?
is a very good question. Balloon material is inert. It is polyurethane, and till now, company has also not reported any allergic reaction to it. It is very inert.
Okay.
Anything else?
Sir, Bhumika this side.
Yes, yes, yes.
Sir, can ORS be given to a hypertensive patient because it
Yes,
has
yes, yes,
a
yes,
lot of
perfectly.
sodium? So,
ORS is a solution which is safe for diabetics, hypertensives, everyone, because it has electrolytes which are not in excess of daily requirement. See, whenever somebody has diarrhea or somebody has vomitings, ORS is the replacement fluid because it is isoosmolar. You understand the isoosmolality? The osmolality
yes,
of
sir.
our plasma is same as in ORS. But some fluids like salt water, nimbu pani are hyperosmolar. So we ask them to take ORS because it is isoosmolar. So you can give safely to diabetics, hypertensive, everyone.
Okay.
Yes,
सर गुड इवनिंग
yes.
प्रिया गुप्ता
हाँ जी बोलिए.
सर मेरी नूर सर से बात हुई थी मे भी उन्होंने आपसे डिस्कस किया होगा
हाँ हाँ.
तो मैंने उन्हें कहा था कि डाइटिशियन का मुझे कुछ वो फॉलो करवा दीजिए
ठीक है, आप इतनी सारी डाइटिशियंस है, इसमें से एक को हम आपके साथ टैग कर देंगे कल से, कोई इशू नहीं है.
जी
लेकिन
सर
आपको हमारी बात माननी पड़ेगी, बहाना नहीं चलेगा फिर उसमें कि
यस
पैर में
सर
दर्द है, चल नहीं सकती, ये नहीं कर सकती, वो चीज़ें छोड़नी पड़ेंगी आपको.
उसमें प्रॉब्लम नहीं है बस थोड़ा सा इशू वही चल रहा है मेरा
इशू
मुझे
है, मैं समझ रहा हूँ इशू है, लेकिन इशू से बाहर तो आना पड़ेगा ना. अगर डाइटिशियन भी कुछ नहीं कर पाएगी, अगर आप उसको छोड़ोगे नहीं
यस सर
तो अगर आपने मन बना लिया, मैं आपकी मोटिवेशन की वेट कर रहा हूँ. Once you are motivated, we have this group of 30 dietitians from all over India. They are all excellent dietitians. They can only help if you want to help yourself. लेकिन
यस
for
सर
a namesake, आज उसने आपको चार्ट दिया and you don't follow it, it will be of no use. So if you promise me that you will follow, I will give you a dietitian tomorrow.
यस सर आई प्रॉमिस यू
Okay. So I'll give you a dietitian tomorrow. Don't worry.
थैंक यू सर
Yes, anybody wants to ask anything? No questions?
Sir, regarding Fatima, here, regarding the protein is the very important part in a diet. So minimum we usually give 1 gram of protein per kg body weight. So if the patient is not, if patient is eating less quantity, and if he's not following, like you told in second phase or third phase,
Mm-hmm.
they are taking the homemade food and they are decreasing their protein intake, so definitely their muscle mass will lose.
Mm-hmm.
So how to keep a check on the patient they are having the enough protein?
That is why
They are
I asked.
continuously
Yes,
interacting with the
yes.
dietitian.
Very good question. And that is where, that means you care about your patients very well. That is why you are asking this. See, important thing is, that is why I asked you to make charts like 1500 calories, 90-gram proteins with options. Because in the end, they are the charts that will help you, give you, and all the recipes I asked you to make high protein recipes. See, what patient will ask you when during the high protein phase, madam options bata dijiye, give me options. So you have already made your recipes, you have already made your charts, you can ask them to do it. It's how one homemade protein recipe is 25-gram protein. Okay, then one 100 gram of soya is 50-gram of protein, 100-gram of paneer is 20-gram of protein, 100-gram of cheese is 20-gram of protein. So you can, according to the patient, you can give them different recipes. See, they have to think that they are not कि वो बीमार नहीं है, उनको हेल्दी खाना मिल रहा है. जब when we give them khichdi and all, they think they are not health, they are sick. That is why they are been given this diet. But if you give paneer bhuji in low oil, that somebody has given me a thing of paneer bhuji, somebody has given egg wrap who is non veg, it is a healthy diet, and it is patient can take it very easily. So if somebody is give a recipe of a high protein tikki or a high protein parantha like paneer parantha, patient will take that. So that is why diet for a patient is not fixed. Same diet will not hold true for everyone. You have to discuss with them their choices, then change. Then only the results will come. See, you said 1 gram per kg. Imagine 150 kg patient needs 150 gram. I don't think you can provide 150 grams to them. And before surgery, they were only taking 20 to 30 gram of protein. That is why they accumulated fat. So even if you give them 60 to 90 grams of protein, slowly the fat mass will go down, their weight will go down, then a time will come when they will be 100 kgs, and then you can fulfill their requirement at that time. That is why initially protein supplements are important, because if they take this homemade protein twice a day, they have already taken 50 gram of proteins. They can go till 90 to 100 gram easily. That is why counseling them again and again that homemade protein or high proteins like whey protein are important, because the other proteins like glucose, glucerna, optifast, they are very low concentration of proteins, only 6 to 10 grams in one go, which is very less. So we have used all the proteins, obesigo, optifast and all. Now we have shortlisted that whey protein and homemade protein are the best. Understood the point?
Yeah, yeah. And sir, you have said that no butter, no ghee. So butter and ghee are the fat content which usually provides satiety. If the patient is, see, and it is, fat is one of the important component. It's the if we stop carbs, it's okay, but if you stop fat and this, the body, your hormone system will not get disturbed completely.
Patient has a excess of 60 kg of fat in the body. That is how the body will use that fat.
So
If
it's
you,
fine if for a
yes,
few
yes,
days if
yes,
you avoid.
patient has 60 kg of extra fat already in the body. See, some people, I am not saying oil, ghee, fat is wrong. Oil, ghee, fat, if for a normal healthy person is absolutely fine if they are walking for 5 kilometers in a day, then it is very healthy. But if somebody is not walking, that extra fat is converted to obesity only. So if you are not giving them initial fat or oil, 1 teaspoon of oil is fine. If you are not giving them, then also it is fine, because the body has lot of extra fat and body will use it. All the obese patients have, who are more than 120 130 kgs, they have 30 to 40 kgs of extra fat. The body will use that fat. So no need to worry.
Okay, sir.
Anything else?
So thank you.
Hello, sir.
Yes.
It's Tejaswini, sir. I have
Yes,
a
yes.
question
Yes.
regarding the visible fat. from phase 3, how much serves should we suggest them to take in a diet, like oil, ghee, or butter?
For
The serves I'm talking about.
for which patient at what time?
After the post surgery or after putting a balloon, like
I am telling
gastric
you
balloon.
कि initially no fat, no oil, nothing. That is what
No,
they
sir,
ask.
after phase 3.
Phase 3, okay. Phase 3 you can use at you use normally that 1 to 2 teaspoon of desi ghee they can use if they are walking well, and also 1 to 2 teaspoon of normal healthy oils can be used if they are walking well. That is not a problem.
Okay, sir.
If they are using desi ghee, they have to walk. Otherwise, no desi ghee. Just give them those oils like PUFA, polyunsaturated fatty oils, and all. Any other question? So let's do a feedback. Are you guys enjoying it, or it's just another school teaching?
We are enjoying.
Okay, great. So are you happy with the timing of the program? Do you want it to be preponed from 6 to 6:30 from next Monday, or 8 o'clock is fine?
Can we make it earlier because married के साथ बहुत मुश्किल हो जाता है सर.
So if everybody agrees, can we do the next program from 6 to 6:30 from next Monday onwards?
Yes, sir.
Yes, sir, please
All
do.
all of them agree?
Yes, okay.
Yes, sir.
Anybody who does not agree? Anybody who does not agree? Anybody who does not
So,
agree?
so means it is half an hour delay you will do according to
No, I am taking because the class is 8 to 8:30. I am saying the next Monday the class will be 6 to 6:30.
Indian time.
Yes, Indian time.
6 to 6:30 will be
6 to 6:30 fine or no?
no, sir. I'll not be free at that time.
Uzma is not. So people are divided. Some is saying 8 is better. So 8 continue at 8 only fir.
Yes, sir. It will be
Yes,
better
sir.
for me.
So all are happy for 8? Okay. So I think we will give we already have given partnership letters to few of them. This time Amir will share partnership letters to Daksha, Bhumika, these two people, because their recipes were very good. So I think they will understand when they receive the partnership letter how we will involve them in our patient care. Okay. So for the next uh, do you want to present also 5 minutes presentation for 2 or 3 people on some topics? Anybody interested?
Yes,
If
sir.
so, I think I will give you a topic of one of them present on keto diet for 5 minutes only, 5 slides. Who will present on keto diet? Just tell me your name. Nobody. It is okay. We learn from each other. If you don't present, you will. I know you know everything about keto diet, but still, Yusra will present keto diet, right?
So
Yusra, you are okay with keto diet presentation?
yes, I'm okay sir.
So give 5 minutes and 5 slides only. Your 6 7 slides. Second
Okay,
is
sure.
intermittent fasting. Who wants to present on intermittent fasting?
Sir, I want to.
Who?
Mahi Patel.
Okay, Mahi.
Sir, Divya Chaubey.
Who is next?
Sir,
Mahi.
Divya Chaubey.
Mahi will present on intermittent fasting. Keto diet will be presented by Yusra. For Divya, I think you can do for 5 minutes, like 5 to 7 slides on weight loss herbal products. Okay?
Okay, sir. Yeah.
If you do this, your practice will change drastically. Once you study, even when I am talking with you, I am learning myself new things, which I may not have learned because I am going into the details of everything. So these 3 people will present next time for 5 minutes, 5 slides, and 2 people will get the partnership letter, and I hope you all will enjoy. So if whatever recipes you have sent to me this week if you can make the videos of that, that will be the best for you. So this is the homework. Whoever has sent recipe, at least make 1 or 2 videos. If you can make videos of all the phases, that is very good. Again, that will help you in your patient care. See, when I give you the patient, you are already prepared. They ask you any high protein recipe diet, you have a video, you have a recipe, you send them, they can make it easily. So I'm preparing you for the things in future. And maybe if you work with other people as well, I am pretty sure that you will be above par with all the people around you, because they will not be knowing about the procedure, they will not be knowing about the dietary phases, they will not be knowing about other things, but you will know a lot of things which even a lot of doctors will not be knowing about it. Remember this point, repetition plus perfection, in your mind when you deal with your patients. Okay, so try to make videos and see you next Monday. I think if everybody says 8 o'clock, it's a democracy. We have to go at 8 o'clock only. Okay, good night.